And I said, come over, just come on over, you'll say. Yeah.
Good morning, ladies and gentlemen, and welcome to the Town of Portland podcast. This is your host, Dave Kuzminski. We're live here in the podcast studio at Portland High School, and with us in the studio is our first Selectwoman, Miss Susan Bransfield, and joining us on the phone, we have our frequent flyer, our Chatham Health Director, Mr. Russ Melmed, and we have another guest who is the Director of the Youth Services as well as the Senior Center, Miss Mary Pont, and she's going to talk about vaccinations today. So, Susan, what do you got going here? It's a gorgeous day. We've got the snow is melting a little bit.
It is, yeah. Now it's a beautiful day here in the studio on Thursday, and just want to have a huge shout out to our Public Works Department, Dave, and grounds folks. They've just done a fabulous job keeping us safe and being able to get outside and enjoy the outdoors. This morning I was out at the Route 17 park, and we've been able to plow the road, so you're able to walk on that nice horseshoe-shaped road, and it really was pleasant. It's beautiful to be able to get out and visit our parks and to be able to get to school safely, as well as to our businesses. And speaking of businesses, Mary Dickerson, our economic development and planner, is sponsoring and getting everyone involved and going out to eat. If you go out and eat in one of the Portland restaurants right now during the month of February, save your receipt. If you spent $25 or more, send it to Mary, her email. It's all described on her Facebook page and our website. And you'll be entered into a drawing. I picked the lucky winner this week. Actually, it was Miss Deb Ellsworth. She drew the lucky number, and she will get a gift certificate of $25. Actually was to Bud's Cafe. And it's a real fun diversion this winter to be able to get some delicious food and then in turn get a prize. So that's been a nice addition to some things that are going on in Town Hall. Last night, the selectmen met. We had a wonderful presentation from Mary, and Mary Pont's going to talk about the vaccination clinic in Portland, along with Chatham Health District. So we'll look forward to hearing what she has to say. It was a great presentation last night. The selectmen expressed such great support and thanks to our Chatham Health District and the efforts of all our town staff and folks making sure that vaccinations are occurring. We're going to hear a little bit more about that, Dave, in a few minutes, so I'll leave the details to our guests.
Nice.
But I'm really grateful for all the people that work hard to make sure we're getting through COVID-19 in the safest way possible, and perhaps bringing us all a little closer in many ways.
Absolutely, absolutely. And Lunch at Bud's, if you haven't had Lunch at Bud's, it's the best kept secret in town. For what you get, for what you pay, you can't beat it.
Yeah,
and so forth. So great sandwiches, great specials. So great. Well, thanks, Susan. That's awesome. Again, I think as you said, just echoing your kudos to our Public Works Department on this mammoth snowstorm that we got. I think they did an awesome job.
For sure.
The roads are in great shape, and we're getting a little melting, so that's a good thing too. So go from there. Okay, without any further ado, let's Russ, let's go over to you on basically on anything happening in Chatham Health. I know you've been just kind of sitting around with your feet up and with eating bonbons and
yeah, just waiting for something to happen. It's so boring over here at the health department lately.
Planning your snacks for the Super Bowl.
Right, exactly. So we're generally just for situational awareness for our listeners. We're heading in the right direction in terms of our COVID-19 case numbers. In town of Portland, we are at around 46 cases per 100,000, which is down off a peak of around 60 cases per 100,000. If you had told me 3 months ago that I would be cheering for a case rate of 46 per 100,000, I would have told myself that I'm crazy. But that's just sort of where we were was a very, very bad place, and where we are is slightly better. So I think we're seeing the result of people having gotten together a lot over the holidays, where we saw this massive surge in cases, and now it's seeming like a more typical January with a lot of cold weather and snow, where people really aren't getting together much outside their homes. So that's good news. That's why we're seeing case rates start to decline, and we hope to see that continue. Just about every town in Chatham Health District is seeing declines every week. So that's all good news. The other good news is we've begun to roll out vaccine to eligible populations. It's very, very limited right now. The amount of vaccine coming into the state of Connecticut is tiny, about 46,000 doses a week for a population of 3.565 million. We're prioritizing right now residents who are 75 years of age or older. In the state of Connecticut, that's around 277,000 people. So you can do the math, 46,000 doses per week and 277,000. It's going to take a few weeks before we're able to even offer first doses to all of these folks. But we're already doing a pretty good job in Chatham Health District. We have offered, these are preliminary statistics, 66% of our residents who are 75 plus have gotten their first dose of vaccine in Chatham Health District. That ranges from around 46% in Portland to around 84% in Hebron. I expect these numbers to change, especially since we've got a clinic scheduled for tomorrow for our seniors in Portland specifically, which I'll let Mary talk about. But, the amount of vaccine out there is limited. The systems in place for people to register to get a vaccine have been challenging. There's some technology barriers that some of our older residents are struggling with in particular. But we've got this system working for us in Portland right now, in which residents can call the hotline. Susan, I'll let you give the number because I don't know it off the top of my head, and get registered with the senior center for when we're going to host a clinic. This really is for people who can't or have not been able to successfully access VAMS, which is the Online Vaccine Administration Management System. For people that have been able to access VAMS, we just say to you, keep looking for open appointments anywhere in the state of Connecticut in that system, because that's the best and easiest way, once you're in that system, to find an appointment quickly. But for those who really are continuing to struggle with that system of access, we have set up this system in which you can call and schedule, put your name on a list with the town of Portland, and then we are running clinics periodically in which we will schedule people, or Mary and her staff will schedule people for those appointments outside of this cloud-based vaccine administration management system. Again, for those people who, I think we just don't want to leave people behind. And the health district heard loud and clear from our municipalities that we need some kind of system in place to reach those individuals and offer them vaccine who just can't use these systems that the state has rolled out. So while we're not going to win any awards for volume or speed, we're trying to balance that with equity. We're trying to make sure that we don't leave people behind.
Yeah, I think, there are technology challenges out there, especially as Mary's going to talk about a little bit with their the older generations and, even prior to the baby boomers.
Yeah. I do have that number, 860-262-7238, Russ. So that's the hotline in Portland, and I'll repeat it again, 860-262-7238. And it's also on our website, and also just give a call to the town hall. We'll be happy to give it to you if you didn't have your pencil there, but that's the number.
Thanks, Susan. There's other good news. I think that there is continuing to be new vaccine providers emerging. CVS Pharmacy in Colchester just today started accepting appointments for vaccination. So it's not in Portland, but it is just a couple of towns away. Just hop on Route 66, split off on Route 16, and you'll end up almost running smack dab into CVS in about 20 minutes. So they are taking appointments. It's still an online system, but it is not the three-step process that the state has rolled out. It is simply you go online to CVS, you search for your zip code. In this case, the zip code has to be the Colchester zip code, 06415, and you can find appointments available as early as tomorrow. In fact, there are appointments available at CVS. in Colchester. I don't think they're going to be doing a high volume, but it is another option and just indicative of the slow but steady rollout of options for people to get vaccinations. And I hope that continues because what we want to make sure is that anybody who wants a vaccine when they are eligible can get one. That is the big goal. Right now, I'd say we're not hitting that mark, but I hope that over the next few weeks and certainly over the next few months that we get to that point where if you're eligible to get a vaccine, there should be no technological barriers, there should be no administrative barriers, and there should hopefully be fewer, supply barriers in the future.
Sure.
Right.
That's great. Russ, on the supply side, how is the supply chain coming federally? Is that loosened up quite a bit? And
it is not, actually. We're still very limited. We're still not getting much more vaccine, this week than we were getting a month ago. There just isn't enough vaccine. So it's not great. I just want to by the numbers for Moderna vaccine, which is the vaccine that we and most local health departments get administered because the storage requirements are basically normal freezing or refrigerated temperatures, not the super cold requirements for Pfizer. But just for Moderna vaccine, if Chatham Health District is a health department which covers a population of about 63,000 people, if we were to get every single dose allocated to us on a per capita basis, so proportionate to our population of 63,000, if we were to get our fair share of the 23,000 Moderna doses that come in every week, we would only get 390 doses every week. So that still just underscores the degree to which supply continues to be an issue. And I understand that the federal government is seeking to purchase additional doses of vaccine, but manufacturing and increasing manufacturing capacity doesn't just happen overnight. So I think we're going to be in this period for a little while at least where we have many people who are eligible to get vaccine and not enough vaccine to go around. So if you're listening and you're wondering, thinking I'm eligible, I've tried to get an appointment and I can't get one until the middle of March, or, I'm scheduling in April, that you're not alone. That is kind of what's happening right now for a lot of folks. There are 277,000 people who are 75 plus in the state of Connecticut right now, 46,000 doses coming in per week. Once we add the next wave of individuals who will be eligible to schedule appointment, those being people who are 65 to 74, that's going to be an additional 350,000 people in the state of Connecticut. So we will at that time have a total of around 650,000 total people eligible between people 65 age and up. So just it's going to be a slog. It's not going to be easy for a little while, but the state is working on it, and Chatham Health District, your health department, is working on rolling out as many clinics as we can within our means.
Right. Russ, when you get shipped the vaccines that come out of wherever it comes out of, does it go into into Hartford and then distributed for there, or is it?
No, it comes directly from Operation Warp Speed, actually.
Oh, okay.
So Operation Warp Speed is the federal arm or the federal group that has been responsible for the research, development, now manufacturing and distribution of the vaccine. The state of Connecticut, we do send our orders through a portal that the state of Connecticut provides in the Vaccine Administration Management System, but those orders simply go straight to Operation Warp Speed, and they get sent to us directly. The state does not send us the vaccine, I don't believe.
Okay, just to clarify that. So, awesome. Fantastic. All right, we're going to turn it over to Mary. Russ, we're going to come back to you in just a second, but Mary, you did a great job last night in the Selectmen's meeting, so tell us a little bit about the procedure that you guys set up. We set up with the hotline and how that's working.
I think one of the first things that we did working with Chatham Health was that when they had made the decision to do, which was held at our high school, their vaccine clinic up there, we did I'll call it a quick run with them to do a trial run of how we could get our seniors registered for that clinic. And that was working with the folks in the office at Chatham Health. One of the things that we found out right away, as we were getting many, many calls coming into the senior center, was that I'm going to say more than half of the people that were calling in did not have email addresses. In order to be signed up for that clinic at the high school, they needed email addresses. So putting the list together, I would send the list off, and then, lo and behold, 2 would get popped out of the system because they had already been signed up in the VAM system by a family member, maybe themselves, but they were desperate to get into Portland. So then we would add a few more people, and the same thing was happening. So it took quite a few tries to get the eligible people into the trial system with Chatham to get to that first initial clinic. After that, we started talking and saying, we have so many people that they don't even have computers, let alone having email addresses. And their kids are going in and starting to try to register in VAMs using their email addresses. In doing that, it prevented them, their children, from going in themselves to register because the email address was already being used. So there were so many roadblocks that were put up. Talking with Chatham, and with Russ and his crew, it's been a great partnership. I have to tell you, it's been a great partnership working with Chatham Health. And we had talked about how could we have a clinic here in Portland for our 75 and up seniors that they were going to be able to call and be able to get into a clinic to get their first vaccine. Working with Dave, put together the hotline. And Susan did repeat that number. I won't repeat it. We'll do it in the end, but I won't repeat that number. And putting that together and then getting the word out, we were just starting working in the system, so we knew that the hotline was out there. And people were told, call the hotline, leave your name and your phone number. People from our Portland library picked up that message, and they, in return, asked all the pertinent questions that needed to be asked, filled in the sheet that needed to be filled in for Chatham, and forwarded that to me. I reviewed it, sent it on to Chatham. Now, one of the things that we found, a couple things, was people, as soon as they had a person talking to them, they immediately thought they were already going to be getting their shot, which they weren't. We also know we have to keep reminding them, you do have an appointment, or no, you don't have an appointment. But that number went live, I'm going to say 2 o'clock on a Monday. Tuesday morning when the library staff came in, they had 50 calls already on that hotline. It took us, I'm going to say 2 days, to basically fill the first clinic, which we had hoped was going to be this past Monday. And then Snow had a different idea about that, which put us into warp speed over the weekend with talking to Chatham and dividing up the list and calling all the people that were registered for this past Monday. So we're hopeful, and I'm going to say we're moving forward that tomorrow is going to be the first clinic. And we have, I believe, 80 scheduled for that first clinic. We have already but have on our list of waiting between the last 3 days of January, the first 2 days of February, over 100 people in the holding pattern.
That's great.
So we're going to be, working with Chatham on when that's going to happen. One of the things that we have found is that we're getting calls from people that might have already got their first inoculation and gone various places. One person I talked with, she had gone to Terryville to get hers and was trying to find for her second shot. They weren't sure where they could go. They couldn't get back into the system. They couldn't get registered for a second vaccine. With our clinic tomorrow, when they leave tomorrow, they're going to have a card with the date and the time for the next clinic. So they're going to know that they're already signed up for their second shot, which I think is an important second step in what the plan is and how we're going to move forward. And certainly the plan with Chatham, and I know Russ is doing the best he can. He is going through all of our district and through the other towns and doing clinics in the other towns and trying to make sure that all of our seniors were 75 and up. And I think, I'm not sure how many other towns have over 75, but I know that we had the first number of coming in tomorrow, and now we have 108, and I know that there's more out there than that in the town of Portland. So we're going to do our very, very best to try to serve as many people as we possibly can. And I think working with Chatham with this system, I think we're going to be able to provide a great service for our seniors.
Absolutely.
And moving forward, I'm going to hesitate and say when the next level comes, we'll talk about it. We're all going to talk about it. But it's been a team effort. It's been a wonderful team effort. So.
Absolutely, absolutely. And just to clarify too, Barry, that basically, when people call the hotline, again, that hotline number is 262-723-38, area code 860. They call in there. They're going to leave a message, okay? And Jan Nochek and her staff are basically going to call them back, okay? And take their information, and then basically that goes over to you. But once that information is in, again, they're still using the VAM system. Basically, that information is passed on to Chatham Health, which Russ's staff enters that information into the VAM system. Is that my understanding, Russ?
That's correct. So this is something of a workaround for what the traditional way VAMS works is, Mary alluded to this, is using an email. But it's a 3-step process, including a 2-factor coded authentication before you can then even access the cloud-based scheduling platform. So if that sounded confusing to anybody, it's because it is. And that is the traditional way VAMS works. This third-party, what we call third-party system, operates with a scheduling system that is outside of VAMS. We collect, as Mary said, on the spreadsheet, all the information that VAMS requires besides an email address: first name, last name, date of birth, race, ethnicity, address, history of allergic reactions, medications. We're creating a health record that we can then upload into VAMS, and then give somebody an appointment at the point of care. We give them a shot at the point of care. So it's all sort of a manual process, which certainly has advantages for people who just simply can't navigate VAMS otherwise. And there are plenty of those folks. We do give them the second appointment at the same time when they come to get their first, the same time 28 days later roughly, which works very well for them. The pitfall here is, once we go down the path with these individuals, we're responsible for them. They're not going to be able to get their vaccine anywhere else using VAMS because technically they're not in VAMS. So that's fine, and this is what we have to do to get some folks vaccinated, and it's what we will do. But I just want to emphasize that for people who are listening and thinking, well, this is a more convenient option for me, I would just say continue to try to work the traditional VAM system because it is and remains the best way to get a vaccine sooner. Because, as Mary suggested, we're running these clinics all over the district. We do this in 6 towns. We have a limited number of staff and volunteers available to do this. So it's going to be a little while before we come back around to Portland. So for people who can use VAMS or who have family members who can help them work the traditional system and register with an email, they should continue to try to do that in the interim if they've not been able to get a vaccine. But if that just doesn't work out, if that just doesn't work for you, then calling this hotline and getting in on one of our clinics is a good option, as is trying to get in at CVS. It's another one. You can also call the Hartford Healthcare system. They are taking appointments by phone. I think they're operating a clinic. The closest one, I believe, is at Rentschler Field in East Hartford. So, not great options, but there are some options out there. So I think I look at this partnership with the senior center in the town and the health district as being a part on the menu of choices for people.
Right.
It's fitting on a very important niche. That's what it is.
I think one of the things that we've also seen in the state is that they also have recognized that as they've started, and they had to start somewhere with the VAMS process, and recognizing that in going down the list of, their first responders and then now they're hitting, I don't want to say a brick wall, but hitting that wall with our seniors, that they're realizing that they're asking them to provide information that they aren't capable of giving, such as their email address and going in by way of computer. Some that I found, if they did have a computer and it was 4 or 5 years old, it's not fast enough to talk to VAMS. VAMS wants to go a little quicker. So the state has started rolling out, and we will maybe put together the list and post that for folks. The state is putting together more numbers that can be called. And in doing so, it's been easier because they're calling the number. And I have heard last week from several of our seniors that called one of the new numbers and got a call back within a couple of hours from a person, and that person scheduled them for an appointment. They did go to Rensselaer Field, and the next day they had an appointment and got their vaccine and were very happy about how the system worked for them. So there are options, but it also depends on, can you drive? How many people do you have to talk to or ask, can you take me someplace? So I think there's going to be other options for people that are more mobile than some of our seniors. So I think we'll maybe try to put together that list for people. Sure. and supply that as well.
Right.
Yeah, and that may become an easier option or more of an option for people who are 65,
yes.
74, as opposed to people who are 75
yes.
and up.
Right. Now, Mary, my understanding now, the clinic coming this week, is that strictly for Portland residents?
Yes, it is.
That is, okay. And now the other question I have is you mentioned about transportation. Is it going to be an option for the senior van to transport to clinics at all?
Yes.
Or?
Several people have already voiced that they, in asking them, most have said, no, I've got somebody that's going to be taking me. But there are several that are going to be getting transported tomorrow by way of the senior van.
Uh-huh.
And, they will be picked up, they will be dropped, they'll be picked up again and taken home.
Sure.
So
yeah. That's great.
Not a lot, because most of the people have either someone that's going to come with them, to make sure they get in the building.
Sure.
Which is going to keep them, safe.
Yeah, exactly. Well, again, Mary, thanks so much for all of that you do. I know Jan Nochek and her staff over at the library. It's a team effort, and
it is a major team effort. This isn't about any one of us. It's all of us working together as a team, and I think that's the most important thing. That message that I want to send out is this is how we can get things to happen positively. And I know that Russ is going around to all the different towns, and they're basically, I think most, and I'm not sure, Russ, but I think most are also being run by senior centers.
Yeah.
Because I'm getting really calls they want to ask how we're running ours.
Yep, it's the same model in
yeah.
Colchester and East Hampton, though we're doing the clinic at East Hampton at the town hall because the space is better, but it's the senior center staff who are the partner, who are making the calls, doing the scheduling.
Yep.
When we do it in Hebron and Marlborough, we're going to take over Ram High School and do both of those towns at once. So that'll be but similar model where the senior center is the partner. They're making the calls. They're doing the scheduling. They're providing transportation for people who need it. The location is just at Ram High School. So we're trying this model in different ways, but the central theme is, it's a partnership between the senior center staff and in some cases library staff making calls, doing scheduling. The health department comes with the vaccine, the vaccinators, the staffing to run the clinic, and that's basically how it works.
The other thing, this is Susan, the other thing that I like about this system is it's a real person that you're talking to on the phone. And as I've been saying to others, this era is somewhat isolating. Many of us are staying home more, and we're not as connected as we will be or as we were before March of 2020. And this phone call back and forth, and then visiting the friendly Chatham Health District when you go to get your vaccination is really heartwarming. I think it's a chance for us to reach out a little bit and touch one another in a COVID-safe way. And I'm really appreciative of all the volunteers as well as the professionals and our town staff. It's just a nice way to bring our community together.
Absolutely. So anyway, and God knows we're all getting COVID fatigue, especially you, Russ.
Yeah, I think COVID fatigue started for me back in April.
Yeah.
Right.
I do want to just mention one other thing, since we all are really excited about vaccination. I do want to emphasize the need to continue with the same precautions that we've had to this point: masking, social distancing, not getting together socially with people outside of your household. It's going to take a long time before we reach the level of immunity from vaccination that we really need to get back to something resembling normal. So testing is still an important pillar of this response. We have plenty of testing capacity in the state of Connecticut. If you feel sick at all or you find out that you were around somebody with COVID-19, you should not hesitate to get a test. You can get a test in a lot of different places. Same-day appointments in most circumstances are available. Testing turnaround times are around 48 hours now. So there should be no excuse. Even if you've got mild illness, just go get a test. It's really important.
Yeah, and I think one thing you probably should mention, coming up this weekend, obviously, is the Super Bowl, Russ. So you want to plan plan accordingly. So you got any advice for that now, Russ?
Yes. The way to plan accordingly is to not plan any kind of big social gathering. The way to plan accordingly is if you want to get together with friends or family that don't live with you, get on Skype, get on Zoom, get on FaceTime, watch the big game with them that way. You can still enjoy each other's company in that way without creating another post-celebration surge, if you will, like we saw after Thanksgiving and after Christmas and after New Year's. We don't want to see the same thing for after Super Bowl because there's always a reason to get together. Every month or two, there's something. And, sad as it is right now, I just encourage people to do something quietly with their own family and their own household, and that's it.
Yeah.
Or if you do decide you want to have people over, just tell them they're more than welcome, but they're going to have to be outside.
Outside. There you go, Mary.
There you go.
And bring your own fire pit and wood.
And ventilation.
And TV.
And TV, exactly. Yeah. All right, guys, fantastic. I think, too, from that standpoint is, coming up, and just a note on our end here, we just started the second semester here at the high school, and we're back full in at the high school. So, and everybody is socially distancing up here. I've got Dr. Britton's going to be doing his podcast next week and so forth. So, but right now, everything's going away, and I think, as Russ says, the numbers are looking decent. Hopefully we can keep that trending down to go from there. But I think for the most part, I think we're in better shape than we were.
Yeah.
From that standpoint. So, all right, Russ, Mary, thank you so much for all of your hard work and input. And again, that clinic is this Friday, correct? Now, Mary.
It is this Friday.
And
tomorrow, rain or shine, Mary.
Tomorrow, rain or shine.
That's right.
Even if they're telling me that they're getting their hair done today, I'm telling them.
Well,
put a babushka on. Put an umbrella up.
I'm getting my hair done today.
Good.
Yeah, he's getting curls.
And our grounds people are on high alert to be zooming around the building to make sure everything is safe for our seniors.
Great. Well,
the room is all set up, ready to go. They just have to come in and bring their stuff.
Fantastic.
Great.
So,
Great.
All right. Well, thank you so much. And ladies and gentlemen, you're listening to the Town of Portland podcast with our guest, Miss Susan Bransfield, our first Selectwoman, Mr. Russ Melmed, our Chatham Health Director, and our Director of Youth and Senior Services, Miss Mary Pont. So thanks so much for participating, and I hope you find all this information, and keep up the good work, everybody. And I'm your host, Dave Kuzminski, and until next time, please stay home, stay safe, wear your mask, and wash your hands. We'll see you soon. Thanks so much. Thank you for joining us today. I'm your host, Dave Kuzminski. Please tune in every week for new and relevant conversations about the town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.